Do you often feel stuffy in your nose, sneeze a lot, or have a sore throat when it's cold outside? Maybe you've even felt too tired to go to school or work. That's likely the common cold talking. It's one of the most common illnesses people get, so common that adults catch it 2 to 4 times a year, and kids even more. Think of it like an uninvited guest that shows up, causes a small mess in your body, and leaves in about a week. Have you ever noticed that after playing with a friend who was sneezing, you got sick a few days later? That's how sneaky the cold can be. But don't worry, it's usually not dangerous, just annoying. What actually causes the common cold? It's mostly tiny germs called viruses, too small to see, but powerful enough to make you feel awful. The most common ones are rhinoviruses, which cause around 50% of colds. Adenoviruses are another type that can also cause colds, along with pink eye or fever. Imagine these viruses like tiny pirates sneaking into your nose or mouth when someone nearby coughs or sneezes. You might pick them up from touching a doorknob after a sick person and then rubbing your nose. That's how they invade and start causing trouble in your body. How do you know you have got a cold? Well, your body sends you signals. Do you keep sneezing like you are allergic to pepper? Is your nose running like a leaky faucet, switching between clear and yellow mucus? Maybe your throat feels scratchy, like sandpaper when you swallow. Other clues include a mild fever, headache, or feeling more tired than after a long day at school. Unlike the flu, the cold usually does not knock you out completely. You might still be able to walk and talk, but you are definitely not at your best. Think you can go to school, but you would rather lie on the couch watching cartoons with a blanket and tissues nearby. There's no single test for the common cold, but doctors usually know by asking about your symptoms. Have you had a runny nose and sore throat for a few days without high fever or trouble breathing? Then it's probably just a cold. The bad news, no medicine kills the cold virus. The good news, your body can fight it off on its own. So treatment is about feeling better, not curing it. Drinking warm soup, resting, and sipping water help a lot. Over-the-counter medicines like paracetamol can reduce fever or pain. But never take strong antibiotics, they don't work on viruses. Think of your immune system as a superhero team. Rest and fluids help them win the battle faster. Can you avoid catching a cold? Not 100%, but you can make it harder for viruses to attack. Wash your hands often, like after using the bathroom, touching door handles, or playing with pets. Use soap and scrub for 20 seconds. Try singing happy birthday twice. Avoid touching your face, especially your eyes, nose, or mouth. If a friend is sneezing, give them space or offer a tissue. Also, keep your immune system strong, eat fruits, sleep well, and stay active. Think of your body like a fortress. Clean hands are guards, and healthy food are supplies to keep the walls strong against virus invaders. Scientists are still learning about cold viruses. Recently, researchers found new details about how rhinoviruses hide from our immune system by changing their outer coat, like a thief changing outfits. Other studies are testing drugs that block the virus from entering our cells. One experiment used a molecular trap in the nose to catch viruses before they infect. Also, better hygiene products, like antiviral doorknobs or masks with virus-killing layers, are being tested. Imagine future tissues that not only wipe your nose, but also weaken the virus. While there's still no cold vaccine, these advances bring hope for fewer coldy days in the future.